Lift. Pull the gear down so that carriage engages. We are able to get it done safely and efficiently.
Often we're called for a scene like this, where a patient needs help getting to the hospital, where we would normally manhandle or just lift the patient out of this chair or a difficult lift situation, where we would put an excessive amount of strain on the soft tissue structures in our lower back, having to physically get the patient up into a standing position so that we can either assist them and or pivot them onto a transportation device such as a stair chair or a stretcher. What I want to propose to you though is using the tool that you already have on your ambulance. Something to help you work smarter, not harder, where you and your partner can lift together utilizing leverage, not just brute force, to reduce the strain on your lower back so that you don't get hurt. So what we can do in these situations where we would put ourselves at risk and also potentially risk an injury to the patient from a drop or a slip is we can use our transfer tool like our tarp. So what we've done is we've taken our tarp, simply folded it in half so that now we have a device that can help us assist the patient out of this dangerous lift situation. And we're going to go into what we call a warrior stance. And in this warrior stance, we're going to have a nice wide base of support, 1 foot forward to the other, always lifting with a head up posture. What that allows us to do is get some good pull and some traction. Now what we can also do to assist the patient reduce their chance of falling is we can cross this tarp around her, further increasing our leverage, but also making sure that we don't drop the patient. Go into our warrior stance, head up, shoulders back. Obviously, we would clearly communicate with the patient. 1, 2, 3, lift. And at this point, we've been able to safely and efficiently lift the patient up out of the chair, and now we're ready to assist her to her transportation device. So at this point, instead of just assisting the patient down where I'm having to reach underneath their arms or possibly behind her back where I'm putting myself at risk with a bad lift position, we can continue to use our tool as a device. I'm simply going to pull traction in my warrior stance with 1 foot forward, both hips engaged. I've now got control of the patient's weight. All my partner needs to do is stabilize our transport tool as well as assist the patient, and we'll call out 1, 2, 3, down. By following this technique, we're able to use a tool to work smarter